So today we're going to be doing inhalation somatic dysfunction of the first rib, also known as elevated first rib. This is a counterstrain technique, which means it's indirect and passive. So first I'm going to find the tender point, which would be located on the superior posterior aspect of the first rib. So to find that tender point, we're going to pull back Neil's traps, and we're going to check this bilaterally. And we're going to press down inferiorly and posterior to the aspect of the first rib. Neil, do you feel any tenderness?
I do.
On what side?
Left.
Left side. So what I'm going to do is I'm going to establish a pain scale for this tender point by pressing in and telling Neil this is a 10 out of 10.
Okay.
And so at this point I'm going to maintain my finger position, but let up on the tender point so I can move Neil into a position of ease. So for this technique, you're going to be cradling the patient's head, inducing some extension, side bending away from the tender point, and rotation of the chin towards the tender point. I would recheck the tender point. Neil, what would you rate this on a scale of 0 to 10?
I think a 2.
A 2? Okay. So this is a 70% reduction in the pain scale, so I will maintain this position. I would hold this position normally for 90 seconds or until I feel a therapeutic pulse or a loosening of hypertonicity of the muscles. For the purpose of this video, we'll cut it short. So then I'll move Neil passively out of the position very gently, and I will recheck the tender point. Neil, what would you rate it now?
Like a 1.
A 1? Okay, so this would be a successful counterstrain technique for inhalation somatic dysfunction of the first rib, or as we mentioned before, elevated first rib.